ACR Bulletin Podcast, the show where we examine the latest trends affecting radiology. I'm your host, Chris Hobson, and today we'll be talking with Julia Schoen, MD, MS. Dr. Schoen is a third-year radiology resident at Wake Forest School of Medicine and is co-founder of Radiologists for Sustainable Future, a group of radiologists interested in promoting sustainability and reducing the environmental impact of radiology through education, policy efforts, and research. Dr. Schoen, it's a pleasure to be speaking with you today.
Thank you so much for having me here today. It's an honor to be on the show and get to, speak about a topic I'm passionate with the radiology community.
Absolutely. And as we were talking about before the show started, this is actually a brand new topic for me. So I'm really interested in learning in real time here along with everyone else. Well, and to that point, we'll be discussing environmental sustainability in radiology today. So for those in the audience who may not see an obvious link between climate change and radiology, could you please help us understand the connection a little better?
Yeah, of course. So I think in sort of the very broad 1,000-foot view, climate change is a global public health crisis. So it's something that sort of concerns all physicians. It's, already starting to have a wide range of effects on different populations. We see this in extreme weather events like wildfires and hurricanes. And then there are certainly more indirect effects in terms of air pollution and water pollution that are expected to magnify with climate change, that are going to have an effect on the populations we serve. And this effect is kind of predicted to affect vulnerable communities and disadvantaged communities more severely. So it becomes a health equity issue too. And then in terms of our radiology practices, all of these extreme weather events disrupt supply chains, as we saw in Hurricane Maria, and also impact healthcare system operations. So workers get displaced by things like wildfire in California. We've seen that happen. There are power outages. Obviously, radiology is a very energy dependent specialty. So we need a reliable power grid. And then finally, just looking at sort of the data that's been coming out over the years from different scientific bodies and the most recent IPCC report, we need to, as a global community, we need to be carbon neutral in the next several decades. And that includes everyone. So radiology sort of falls into that. So that's something that we sort of, I think all industries, we typically think of agriculture, construction, transport, energy as the big ones, but all industries really need to sort of have some kind of self-reflection at this point of, to protect the planet for future generations. How are we going to achieve this goal of carbon neutrality in the next several decades?
I saw something you wrote recently where you mentioned that the US healthcare system is responsible for approximately 10% of the United States greenhouse gas emissions. So you alluded to that a little bit in your first answer there, but what role does radiology play in this problem? If you could elaborate a little bit on that, and how much does it contribute to the issue?
Yeah, so I don't think we have great data at this point on how much radiology contributes to the issue. There are a few studies coming out that have been looking at the impact of imaging exams and IR suites and their sort of carbon footprint. But in terms of getting a big picture of where radiology fits into that 9.8%, I think was what that paper had estimated. And I think in general, the estimates for the US healthcare system are somewhere between 8 to 10%. What we do have an idea of is what are sort of the drivers of energy use in radiology. So, in diagnostic radiology, it's going to be the energy use from our scanners is going to be the big one. And then within that, the energy use for heating and cooling scanners. So that's a big sink. And then in IR, you're going to have the same sort of issue with heating and cooling IR suites, as well as the sort of supply chain of energy going into producing the products and devices we use, and transporting those and then disposing them. And that's another area where there's a lot of opportunity, just because we do use so many single-use devices and then just throw them away. And sometimes you open up a whole procedure kit and use only a few items in it and then throw away things that aren't even touched. So I feel like we have a lot of opportunities there to reduce our waste, just because we haven't really been thinking about it up to this point. I mean, I guess I shouldn't say haven't been thinking about it, but there hasn't been that much attention to it up to this point.
That's so interesting. Now, well, you know, again, you touched on this, but there are some interesting stats out there. Like you said, there's not a lot of hard data, but at least there's some statistics, such as you know, especially when it comes to radiology, like over the course of a year, the energy use of one CT scanner is comparable to 5 4-person households, and the energy use of one MR scanner is close to that of 26 4-person households. So you've kind of touched on this, but you know, what are some practical strategies that radiologists can adopt to start curbing some of this? It seems like a daunting problem, I'll be honest, but what are some maybe practical steps in the face of such a big issue?
Yeah, so I think there's some low hanging fruit in terms of, you know, you walk into a hospital in any department and their lights on when no one's in the room. We leave our pack stations on all night. All of those things we can change those, and doing that saves money for departments too. That may not be that's sort of an important step. It may not sort of be the biggest impact step. I think other things we can kind of do is work with vendors and engineers to design more energy efficient scanners. And also just our scanners do produce a lot of heat. I think the study you mentioned talked about ways of sort of recycling or potentially recycling the heat produced by scanners to sort of go back into a hospital HVAC system, which I think is a really interesting concept. Another thing we could kind of look at is just targeted protocols to answer a clinical question. So that's something people are already sort of looking into in terms of just more efficient imaging, but those things will sort of decrease how much we're using the scanner. And then there's energy required to store any of the data that we produce. So you're decreasing that energy we're using to store data in PAC systems.
Mm-hmm. And for people who this may be a little bit new to, but who do speak the language of bottom line, the language of finance, especially people, you know, whether you're how many steps removed from the C-suite or the C-suite themselves. So maybe could we talk about this for a minute in terms of the financial side? What are the connections between maybe escalating healthcare costs and global warming? Again, you in your first answer, you kind of painted a broad brush of some of that effect, but maybe on the local level, you know, what are we seeing and as it pertains to radiology?
Yeah, I think most of the interventions that have been put into place to make healthcare more sustainable, and notable ones that are out there, Kaiser Permanente is already carbon neutral. Other healthcare systems also have, I think the Cleveland Clinic is one of them, have sort of big sustainability programs and departments, and all of the data that comes out from them shows that many of these interventions decrease costs. And it makes sense because most of them are targeted at reducing waste and reducing energy use. So even when it's on a sort of micro level for each individual action, that adds up. I think other things that sort of go along with connections between healthcare costs and global warming. I mean, as we talked about, disruptions in healthcare services. So if you have a patient population affected by a hurricane or displaced by a wildfire, you know, those patients aren't going to be going in to get their mammogram. And then you're going to see sort of down the line a decrease in preventative care and an increase in emergency room visits for negative health consequences from these natural disasters. So I think that you sort of can hit the bottom line on multiple levels. One is more of a big picture kind of population health level and changing patterns of disease and utilization of care. And the other is a more practical, just we can reduce waste in our healthcare system and then save money.
Yeah, I think sometimes it's helpful to have the vernacular for both, when you go into
Yeah.
these kinds of situations. So, well, if right off the top, you talked about health equity too. I know that's a central part of population health and population health management. So let's talk, if you would, for a minute about that connection between climate change and population health, or if you want to, call it public health, that's fine too. I know that's such a Venn diagram where the two kind of overlap, but what role, if any, does climate change play in population health, and why should radiologists in particular be concerned about that?
Yeah, I think that that's a really interesting question. And in some ways, envy is not the right word, but if you were talking to someone in infectious disease, they have a much easier time answering that question because they can just say climate change is going to change the pattern of vector-borne diseases, and that's how that's going to affect our specialty. Or if you talk to an ENT or an allergist, they're going to say, now we're going to have increasing pollen seasons, as well as actually you get things like the air can be more saturated with pollen when it's warmer. So they can kind of say, we're concerned about these increases in allergies. For us, I think it becomes more of an issue of all of these specialties are going to be affected. They all use our services, and it's going to change healthcare utilization in ways that we can in some ways predict in terms of, when you have disruptions in healthcare services, you're going to end up, and also combined with natural disasters, you're going to end up with increased emergency room visits and decreased ability to provide preventative care services. But in terms of the big picture of, how are all of these changes in utilization patterns going to affect radiology, I think that's something we have to kind of explore more, and probably is just really difficult to predict.
Yes, it is. Well, if you
Yeah.
talk about not so much health equity, but population health management and public health in general, it is like, I know as an organization, ACR right now is trying to figure out where radiology is situated in that. It's kind of a new frontier. So I think public health has been around a little bit longer than something like population health, and population health is kind of a new frontier for all of us, really. So it's
Mhm.
great that you guys are already thinking about it.
Yeah, I think one other thing on that I sort of have thought about, and I don't know that there's really that much attention out there, but I think is a unique role for radiology is that we do a lot of screening.
Mhm.
And, as we see things like exposure to wildfire or increased particulate matter from burning fossil fuels, like, should we be changing changing our guidelines around who we're screening based on these kind of risk factors that are going to be getting worse in the coming decades. And so I think those are all sort of interesting questions to attack.
That's really interesting, particularly about lung cancer screening. Probably, I think, is a little bit what you're getting at, maybe there, at least on one
Yeah,
dimension.
no, I mean, definitely with air pollution and wildfire risk, that's what I would be thinking of. Although, I
Mhm.
mean, particulate matter that's less than 2.5 microns in particular has an impact on many different organ systems.
Oh,
It has
interesting.
pretty high cardiovascular risk. Basically, it just crosses into the bloodstream through alveoli. That's why that size is important, and then can get throughout the body and do some pretty damaging things. So it's a risk factor for a lot of different diseases.
That's so interesting. Yeah, I hadn't even considered that. So that's I'm learning something new already. Let's talk about speaking of education and learning things. You co-founded a group called Radiologists for Sustainable Future. Can you tell us a little bit about what you all do, and who
Yeah.
composes the group and things like that?
Yeah, it's been a really sort of an ad hoc group. We all got together in October of 2020, based on kind of some messaging on Twitter. And it's basically just a group of radiologists from around the country who are interested in sustainability. And we've been working on ways to raise awareness about these issues, and then also to figure out how we can study and address some of these impacts. So, you asked earlier the question of what is radiology's contribution to that 10%. So that's a question that, some members of our group are looking into, what data is out there and how can we kind of start to answer that question. And then also just sort of advocating within our own societies and own fields for our own, departments for how we can make things more sustainable.
That's interesting. Now, this question may be a little repetitive because I asked you a little bit earlier about, practical solutions. Do you? But that was more, off the cuff. Maybe some things you've been thinking about. But let me know. But I was wondering if you all, as an organization, have had time to put together, more standard recommendations, maybe, apart from stuff like attending the CT and MR scanners. If there's something, is there anything more that you all have been thinking beyond, the kind of stuff you talked about a little bit earlier?
Yeah, we've broken up our efforts into education, advocacy, and research, and have different teams kind of working on those three topics. We've also talked about quality improvement or working with vendors as potential kind of ways that our group could get more involved in sustainability. And then I think in terms of recommendations for how to get involved in those things, I mean, there are all sorts of kind of opportunities. When you think about education, I mean, every academic department is going to have noon conferences. There are plenty of national conferences that people can kind of bring these ideas to. And climate change in medical education is actually becoming a very big topic. So I was involved a little bit in that in my own med school. And at that time, there really wasn't anything. There were some opportunities to get involved with the university at large in environmental sustainability efforts. And now there's this group, Medical Students for a Sustainable Future, that's sort of part of the broader network that our Radiologists for a Sustainable Future is in. And they are, I mean, very impressive. They've gotten climate change into curriculums in many schools. They publish a report card on hospital or on their school sort of ability to incorporate climate change and be sustainable into their work. Sorry, I got a little off track there.
No, that's great. No, I was going to ask you, because it sounds like so much of what you are doing at the outset is education. I think that's such a good place to start. But I was wondering, you say, part of that's part of almost like a three-prong effort: education, policy efforts, and research. So do you all have plans to push some of this maybe more intellectual stuff into the public sphere, as far as getting policy results and even publishing a lot of stuff? And is that all on the agenda for the future too?
Yeah, I mean, one thing that we are working on now is a resolution for the ACR. So we've been talking to different state chapters about this issue and whether it's something they find sort of important or would support. So that's one thing that we've been doing in terms of policy. We have a few members in our group who are very active in local advocacy and sort of also advocacy at the state and national level. So they're sort of doing a lot of work on the ground, but then they'll share opportunities with us to kind of help support that work. But I think in general, our policy efforts at this point are sort of to try to get radiology organizations to recognize that this is an issue. There are other national medical organizations, the AMA, the American Academy of Pediatrics, emergency medicine, anesthesia has really made a big sort of push in terms of sustainability. So sort of to see where this fits into our work and how we can get support from radiology organizations.
Absolutely. Yeah, that's so interesting. Well, and you've talked a lot up till now about I guess ways that you can, I almost think of it as a bridge to something like alternative energy sources in the future. So you've talked about powering down the EHR and, or sorry, the packs and all the technology you can power down and power back up and things like that. And but do thinking about maybe the mid to further term view, what are you thinking in terms of like investing in alternative energy sources? Is that something radiology should be doing? And what are maybe some examples, if so, of those types of energy sources?
Yeah, so this is a subject I wish I were sort of more of an expert in. The more I learn about it, the more it's sort of very interesting and pretty complex. So I think in terms of sources, they're ones that we kind of traditionally think of like wind, solar, geothermal, biogas. There are hospitals out there. So right, Kaiser Permanente is carbon neutral. I think some hospitals in Boston sort of are working in that direction. I went to a talk from a hospital in Minnesota that was working on increasing their renewable energy sources. And my understanding is that the way these sort of facility managers look at sourcing energy for the hospital is kind of the same way you would look at a portfolio of stocks. So there's this cost risk analysis, and then they're picking multiple energy sources, and it kind of depends on what's locally available. And there are also I think there are a lot of benefits in terms of carbon credits that they can get depending on local policies. So it's a pretty interesting and complex issue. And in terms of like an example would be that hospital in Wisconsin I mentioned gets biogas from a brewery's waste disposal.
Look at that. Hey, all right. So you're really contributing to the future by throwing one back. Okay. We're not going to advocate that on this show. This is a family friendly show, but no, thank you. That's interesting about all that. And it's Wisconsin, so it's local, right?
Exactly.
So they have local solutions and
so they may have a cheese place too.
You never know. You really never know. So is that one of your goals, I guess, to the point of your back to the group is to have that geographical representation across the line, in your membership, reflected in your membership? I mean, is there any thought to doing that in the future? Or I know you're kind of building a foundation right now, but just to get those perspectives that you might not have thought of otherwise.
Yeah, I think that's sort of been happening naturally in the group. I don't know that it's intentional, but we do have people sort of from across the country who are involved in this, and there certainly are different perspectives. And I think it's definitely interesting seeing how different states and different also, I think, age groups view this issue.
Excellent. Yeah, exactly. It's nice to have that diversity on many levels. Well, so how can radiology, how can, like you said, it is a big issue and everyone's educating themselves, but how can radiologists put themselves in a position to advocate for maybe some of these alternative energy sources?
Yeah, so I think there are a few ways. One is just a lot of hospitals have sustainability committees. And so being a part of your hospital or healthcare system's sustainability committee and linking up with the facilities people and kind of trying to push those efforts forwards. But also we're all physicians, and there are a lot of local community groups that are advocating for more renewable energy options within their sort of, counties or state. And so they always appreciate having a physician voice there to say, this is important, it impacts health. And then I think another way is just looking at who we're purchasing from and what kind of energy sources they're using, and trying to get involved in more environmentally sustainable and preferable purchasing.
Interesting. Well, for those folks who maybe are either new in their career or maybe they're at some other point in their career, but they just haven't, interacted to such a degree that they have that cachet where they can, maybe just be a part of one of these committees or have the leverage to kind of look at, purchasing options and things like that. For those folks who might be listening, what would be some very practical first steps that you think maybe anybody in any kind of practice could take to start down this road of environmental sustainability?
Yeah, so I think there are so many ways to get involved and so much work to do. The best way of kind of approaching it is thinking about what you enjoy. So are you someone who's interested in research or local advocacy or learning more about kind of the business case for these things? And then looking at what your local resources are to get involved. So many hospital committees will have a spot for trainees and encourage that kind of thing, or their local groups. There's a great network, Healthcare Without Harm. So our group has become a part of their network. But before I even had this radiology group, this network, Healthcare Without Harm, was where I sort of went to get information about these questions and learn more about different hospitals and their efforts. And then I think there are plenty of resources out there, though, not just that one group.
So interesting. Yeah. And again, so much of this is just, I feel like it's been a kind of a theme of our conversation is education, education, education. Educate yourself, reach out. You don't know what you don't know, maybe, and really just have the courage to take that first step, have the courage of your convictions. So, well, Dr. Schoen, it's been such a pleasure speaking with you. Where can people find you online if they'd like to continue this conversation?
Yeah, I am on Twitter. It's Julia Schoen, MD is my handle. And then our group is also on Twitter. So it's RADS for SF, and that's RADS for SF. So either place would be a good place to continue this conversation.
Yeah. Well, that was my next question, was if somebody wanted to try to join Radiologists for a Sustainable Future, is it best for them just to reach out to you on Twitter, or what if they don't have a Twitter account? Do you have other ways of contacting you? Or?
Yeah, so there's now that we've joined with Healthcare Without Harm, there's sort of a formal link to sign up through their physician network. I can send you that link after the fact if that's.
Yeah, so we can go ahead and put that in the show notes. Yeah, absolutely. Yeah. Please do send that. But yeah, well, that's great. That's right there. That's a great first step for anyone who's interested in doing this. Well, for our viewers, I would just want to turn it to you and say, if you have any ideas for any future show topics, if you enjoyed this topic and you'd like to see similar content in the future, please let us know on Twitter. @RadiologyACR is our handle. And please do use the hashtag @ACR Bulletin Podcast. I also invite you to check out all of our past episodes at Apple Podcasts, Spotify, Google Podcasts, and be sure to please do subscribe to ACR's YouTube channel and to see our latest episodes, and always feel free to leave us a comment. We'd love to hear everyone's thoughts. So thank you so much again, Dr. Schoen. This has really been a pleasure. I really appreciate your time today.
Thank you for having me.
Absolutely. And thank you so much to our listeners. This has been the ACR Bulletin Podcast. See you next time.